Now we're going to talk about hemolytic anemias. And let me use my whiteboard to discuss the pathophysiology of hemolytic anemias. So hemolytic anemias are hyperproliferative anemias. The bone marrow is hyperfunctioning, therefore there is high retics. So this is the hallmark of hemolytic anemias, high retics. Hemolysis, high retics. In addition to the high retics, you have biochemical markers of hemolysis. And they are three. The biochemical markers of hemolysis are three. Increased indirect bilirubin, increased LDH, and decreased haptoglobin. So, whenever you have hemolytic anemias, or whenever you have hemolysis, you need to ask two questions. You need to ask two questions. Why? Why is there hemolysis? Why the red blood cells die young? What is the cause of this? And the second question, where? Why hemolysis occurs and where hemolysis occurs? These are the two major questions. Why also means what are the causes of hemolysis? And where means where are the red blood cells, or where do red blood cells hemolyze? Okay. And let me put the answers for these two questions. Hemolysis. Why and where? So to answer the question, why hemolysis occurs, hemolysis occurs either because of a problem inside the red blood cells, or because there is a problem outside red blood cells. As simple as that. So the causes of hemolysis, something wrong inside the red blood cell. And usually when the problem is inside the red blood cell, the condition is congenital. You're something you're born with. And we refer to this problem as an intrinsic problem. Because the problem is in the red blood cell itself. And because red blood cells are also called red blood corpuscles, so we also call it intracorpuscular. So these are the three names for the first cause of hemolysis. When hemolysis happens because of a problem inside the red blood cell, we call it congenital hemolysis or congenital hemolytic anemia, intrinsic, intracorpuscular. All these are causes of hemolysis. congenital hemolysis, aka intrinsic hemolysis, aka intracorpuscular. We know from this that there is a problem in the red blood cell. If the problem is outside the red blood cell, usually this problem is acquired, not congenital. You're not born with it. You're born with normal red blood cells, but something happens outside the red blood cells leading to their hemolysis. So because the problem is outside the red blood cells, we call it extrinsic. And because red blood cells are also called red blood corpuscles, so we call this extracorpuscular causes. So this is the answer to the first question. Why red blood cells hemolyze? Why red blood cells might hemolyze? The second question is where? Where does hemolysis occur? Where does hemolysis occur? And the answer is either hemolysis occurs in the spleen or hemolysis occurs in blood vessels. So red blood cells can hemolyze. Most of the time they hemolyze inside the spleen, but sometimes they hemolyze inside blood vessels. So when hemolysis occurs inside blood vessels, we call it intravascular. And when hemolysis occurs in the spleen, we call it extravascular. So hemolysis, where does it occur? In the spleen, extravascular. In blood vessels, intravascular. Okay, and in all cases, once you have hemolysis, you have the three biochemical markers of hemolysis. So these three biochemical markers of hemolysis will occur whether hemolysis is extravascular or intravascular. So whether the red blood cells hemolyze in the spleen or in blood vessels, in all cases of hemolysis, you will have increased indirect bilirubin, increased LDH, and decreased haptoglobin. So how can we tell apart? Is it extravascular hemolysis or intravascular hemolysis? The answer is when hemolysis occurs inside blood vessels, in addition to the three biochemical markers of hemolysis, we have additional three markers of intravascular hemolysis. And what are these? Definitely, the free hemoglobin in plasma will be much more when hemolysis occurs inside the blood vessels. So when red blood cells rupture inside the spleen, some free hemoglobin might find its way to the circulation to the blood vessels. But when hemolysis occurs inside the blood vessels, so you're going to have huge amounts of hemoglobin, of free hemoglobin. So we call this hemoglobinemia. So that's, you have hemoglobinemia. Hemoglobinemia. Hemoglobinemia means free hemoglobin in the blood, and that's why the plasma will look pinkish and not yellowish as it normally looks. When you have free hemoglobin in blood, this free hemoglobin will go to the kidneys and you pee it in urine. So you have hemoglobinuria. you will have hemoglobinuria, which is free hemoglobin in urine. And finally, as hemoglobin passes inside the kidney tubules on its way to the outside with urine, it reacts with some molecules in the renal tubules, and the iron of hemoglobin reacts with these protein molecules in the kidney tubules, and we get hemosiderin. So we start having hemosiderin in urine. What's hemosiderin? It is the result of reaction between the iron of free hemoglobin with some protein molecules in the renal tubules. You get hemosiderin urea. So what are the biochemical markers of extravascular hemolysis? 3. Elevated bilirubin, elevated LDH, low haptoglobin. What are the biochemical markers of intravascular hemolysis? 6. The common 3, elevated indirect bilirubin, elevated LDH, low haptoglobin, and in addition to this, we have hemoglobinemia, hemoglobinuria, and hemosideриnuria. Now let's get back to the question, why does hemolysis occur, or what are the causes of hemolysis? So now we're going to talk about causes of hemolysis. So it's either something inside the red blood cells or something outside the red blood cells. These are the causes of hemolysis. Let me start first with the intrinsic causes of hemolysis, or intracorpuscular causes of hemolysis. And these causes are congenital. So intrinsic, aka intracorpuscular, aka congenital. So if we look at a red blood cell, what do we have in a red blood cell? We have the cell membrane, and we have hemoglobin inside, and we have some enzymes. That's all what we have. So the problem, if it is in the red blood cell, it has to be in one of these 3. So what are the cell membrane problems? Cell membrane. Give me example of intrinsic intracorpuscular congenital hemolytic anemia because of a cell membrane problem. Hereditary spherocytosis. Rigid, non-flexible cell membrane, and this results in rupture of red blood cells as they go through narrow capillaries. Now, the second problem can be in hemoglobin. And any pathology in hemoglobin, what do we call it? We call it hemoglobinopathy. Pathology in hemoglobin. Give me examples of hemoglobinopathies. Thalassemia, deficiency of alpha chains or beta chains. So we have alpha thalassemia and we have beta thalassemia. We have alpha thalassemia major and minor, and we have beta thalassemia major and minor. And sickle cell anemia. Again, here, there is one amino acid instead of one amino acid because of point mutation. So that's hemoglobinopathy. The third problem could be in one of the enzymes that are involved in the metabolism of red blood cells. And we have an enzyme known as glucose 6-phosphate dehydrogenase. Some kids are born with G6PD deficiency. Some kids are born with G6PD deficiency. And this is actually a sex-linked, X-linked disease. It's like hemophilia A. Mothers transmit the bad gene to their boys. Mothers transmit the bad gene to their boys. So if you have a boy with G6PD deficiency, this boy got this defective gene from his mom. What happens with G6PD deficiency? These boys with hemolytic anemia, they have normal life until they get subject to stress. And what's the major cause of stress? It is infection. When they get stressed, the red blood cells will hemolyze because they lack the G6PD enzyme. Also, certain types of food can cause this hemolysis, like nuts, fava beans, and also some drugs like sulfa antibiotics. Okay, so these are the causes, intrinsic causes of hemolysis, intracorpuscular, aka congenital. Now, what are the extrinsic causes of hemolysis? Extrinsic, aka extracorpuscular, aka acquired. Here, you're born with normal red blood cells, but something happens outside the red blood cells, and this causes the red blood cells to hemolyze. The first example is autoimmune hemolytic anemias. Your red blood cells are normal, but they are attacked by antibodies that your immune system develop against your own red blood cells. The second cause is your red blood cells are attacked by toxins. Some strains of E. coli produce toxin known as Shiga toxin, and this leads to hemolysis. This leads to hemolysis. And this is seen more in kids. When kids get E. coli, infection with E. coli with that specific strain, they get hemolytic uremia syndrome. Hemolytic uremia syndrome. So they get hemolysis, and the red blood cell debris block the kidney tubules, and they develop renal failure as well. And also malignant malaria. That's a parasitic infection transmitted by mosquitoes in endemic areas of the world. And the organism produces toxins, and these toxins hemolyze the red blood cells. And finally, patients with prosthetic metal cardiac valves. Some patients with valvular heart disease, especially aortic valve disease, need valve replacement surgery. There are two types of valve replacements. Either you replace the valve with tissues, usually we get from porcine species, pigs, or we get metal valves. When we use metal valves, each time red blood cells pass in the heart, they hit into the metal valves and they might get ruptured. So that's a third cause of extrinsic or extracorpuscular or acquired hemolytic anemias. So we discussed the pathophysiology of hemolytic anemias, and we answered the two questions: why intracorpuscular or extracorpuscular, where intravascular or extravascular. We discussed the biochemical markers of hemolysis, whether it occurs intravascularly or extravascularly, increased bilirubin, increased LDH, low haptoglobin. In addition to that, there are three features of intravascular hemolysis, which are hemoglobinuria, hemoglobinuria, and hemosideриnuria. Let me just review this in the PowerPoint slides before we talk about the clinical picture of hemolytic anemias. So these are the features of extravascular hemolysis. And intravascular hemolysis, we get in addition free hemoglobinemia, hemosideриnuria, and hemoglobinuria. So in both extravascular and intravascular hemolysis, you get high reticulocytes, and you get hyperbilirubinemia, elevated indirect bilirubin, high LDH, low haptoglobin. In addition to this, we have three features that only occur intravascular and intravascular hemolysis: free hemoglobin in plasma, hemoglobinemia, hemoglobinuria, and hemosideриnuria. On the long run, as we keep destroying the red blood cells, and the bone marrow will become hyperproliferative, and the bone marrow will need a lot of folate. So you will run out of folate, you will have increased folate requirement. And this indirect bilirubin, the liver will keep converting it to direct bilirubin and will store this direct bilirubin in the gallbladder. So these kids can develop gallbladder stones, bilirubin stones. So if you have a gallbladder stone in a 7-year-old, in an 8-year-old, 9-year-old, that's very unusual, and that's a feature of hemolytic anemia, usually congenital. And on the long run, also, when you have intravascular hemolysis and you keep peeing iron as hemosiderin, you get iron deficiency. So the causes of hemolytic anemia, or why hemolysis occurs, either intrinsic causes, aka intracorpuscular, and they are usually congenital, like problem in the cell membrane, hereditary spherocytosis; enzyme problem, G6PD deficiency; hemoglobin problem, hemoglobinopathy, thalassemia, or sickle cell anemia. Or the problem is outside the red blood cell, extrinsic or extracorpuscular, usually acquired, like autoimmune hemolytic anemia, like mechanical trauma, cardiac valve prosthesis, like infections, malignant malaria. So where does hemolysis occur? We answered that: intravascularly or extravascularly. And in the coming segment, we're going to talk about the clinical picture of hemolytic anemia, and we're going to focus on sickle cell anemia.